Hello everyone. Today we will be discussing about Alzheimer's disease. Alzheimer's is one of the most common form of dementia that is found in the old age usually. As this disease progresses in a person, it slowly and gradually gets worsened and leads to death. If we talk about Alzheimer's was first described by German psychiatrist and a neuropathologist Elias Alzheimer's in 1906, and because of his last name, this disease is called as Alzheimer's. If we talk in a common parlance or a common language, Alzheimer's would be described as a disease having a problem of forgetfulness or a memory loss, and we should know that it is not a normal part of aging. A normal person or an aged person forgetting something would be very different from what an Alzheimer person would do. Most oftenly, the Alzheimer disease is diagnosed in people over 65 years of age, although the less prevalent early onset of Alzheimer's can also occur much earlier. In 2006, if you study the data, there were 26.6 million sufferers of Alzheimer's in the world. If we talk about what are the major causes, one of the major causes could be the different chromosome. Chromosome 1, chromosome 21 and chromosome 14 are majorly responsible for the Alzheimer's disease. The second biological reason could be the plaques and the tangles that take place in the person's brain who is suffering from Alzheimer's. Tangles are entanglement of the different neurons, and plaques are the cellular disposition in the gray matter. This picture actually tries to describe the different tangles and the plaques in the brain of a Alzheimer's patient. So, if we take, let me show you tangles and the plaques, right? This arrow is a tangle and the reddish area, this one, is the plaque. Also, how an Alzheimer's would increase in the patient's brain is now we were going to discuss. Like, for example, I would take in this brain, in the first one, the amount of plaques and tangles is very less. It is only in this area. Gradually, it is increasing and has spread to the lower part, and slowly and gradually, it has covered the complete brain. So, it gradually spreads from one area to another and gradually covering the whole of the brain of the patient. In this is the difference between the CT scan of a normal person and that of the Alzheimer's. If you can see, let me show you, if you can see that the gray matter, the Alzheimer's patient is much more different from that of a normal person. After that, this is the PET scan of a normal brain and that of the Alzheimer's. Can you see the difference between the colored part? You can see these are the dispositions of the gray matter, जो ये difference है, and see the area of blue area in this. Another would be that this is the PET scan of a normal person of a mild cognitive impairment and Alzheimer's disease. Again, the difference in the gray matter is much more evident in all three. So, this is what actually happens with the Alzheimer's patient, where the gray matter size actually increases. Now, let us come to the common symptoms. Though there are different types of Alzheimer's that exist, but there are certain common symptoms which could be seen in every Alzheimer's patient, and let us first discuss those symptoms. The common symptoms would include difficulty remembering recent conversations, names, or events. They would show a lot of apathy. They would show the symptoms of depression. There would be an impaired communication. They usually repeat their things. They have spoken a particular sentence, and they will slowly, gradually, after some time, would again repeat the sentence unknowingly, that because they were forgetful regarding this, that they have already said you this thing. Another would be they would have a poor judgment, and there would be a disorientation and confusion in the Alzheimer's patient. And there are different types of Alzheimer's: early stage, middle stage, early age, middle age, and late age. So, in early stage, the common factors are forgetfulness, loss in common places. They are not able to keep the track of day, time, and date. There is a problem in communication, and they have difficulty in carrying out the daily life activities. When we go for the middle stage or the middle age, there would be more forgetfulness, increase impairment of communication. There would be need of the person care. That means there's a second person who will be taking care of them, and they will unable to live separately. In the later stage or later age, they would be unaware of the place or time. They would difficulty in understanding what is happening around. They were not able to eat and swallow. Behavioral changes would be there, and there would be problem in mobility. They were not able to move from one place to another. Also, some psychiatrists or you can say doctors say that there are 7 stages of Alzheimer's and 7 diagnostic stages, and it would take approximately 8 to 10 years to progress through all stages. And if a person is diagnosed with Alzheimer's, it would be more than, I think, he would survive or she would survive for around 20 years after the first neural change. So the first stage is no impairment. In stage 1, memory and cognitive ability seem to be normal, but during a medical interview, a healthcare professional identifies no evidence or memory of cognitive impairment or cognitive problem. The second stage that comes in is the minimal impairment or very mild cognitive decline. That could be normal age related changes, or the earlier signs of Alzheimer's uh, are actually not identified by your family members or friends or healthcare professionals. Approximately 50% of the people in age of 65 or over actually start experiencing slight difficulties with recalling the occasional words and concentration. Person may also feel that their memory lapses, or like they would forget the names, they would forget the words, and or they will forget simple things like where they have kept their keys or glasses or something. The stage 3 is early confusional stage or mild cognitive decline that has the duration of 2 to 7 years. The early stage Alzheimer's is sometimes diagnosed at this stage, means your early age is the stage 3 according to this. The patient has slight difficulty which have some impact on everyday functioning. They also have problem in recalling words, organizations, plannings, etc. They would have problem in reading a particular passage, or would have problem in retaining the information. They would have problem in organizing the thing. There would be moodiness, anxiety, or there could be a depression. The stage 4, that is the moderate cognitive decline or the milder early stage of Alzheimer's, its duration is basically 2 years, and these symptoms would actually confirm that yes, the patient is suffering from Alzheimer's. In this, still they would be aware of their self. They would able to identify the family places. They would reduce memory of personal history. They would have problem with numbers which impact their family financial, like they could not manage their bills, they could not manage their checkbooks. Numerical exercises, they would have problem counting backward. These were the common problems that Alzheimer's at this stage would show. They would their knowledge of recent occasions and current events would also decrease, and the sequential task would become more difficult from them, like driving, cooking, planning would become difficult from them. They usually would withdraw themselves for conversations and social situation because that would be a challenging situation from them. They would deny and would become defensive. The fifth stage is moderately severe cognitive decline, which is the moderate or mild stage Alzheimer's, that is about 18 months. In this, there would be cognitive deterioration. They cannot survive independently. They cannot remember details of their personal history. They are usually confused with days, months, and years. They're confused with the things. They would have problem in mathematical abilities. They would require supervision. They would also have problem in dressing, including what to wear, how to wear. They would require help in carrying out their daily activities. The stage 6 would be severe cognitive decline. That would be moderately severe mild stage Alzheimer's disease, and its duration would be 2.5 years. Memory would continue to deteriorate at this stage, and there would be changes in personality. Virtually, they would be totally aware of their presence. They cannot recall their personal histories. They can still recall their own name, but they would be have problem in recalling the other person's name, and there would be problem in urination. They would lose their ability to take bath. They would need help while going toilets. So these are the changes that you can observe in a stage 6. The stage is, there would also be even this stage 6 would also be characterized with problem in sleep, and they would actually wander off. They would be suspicious, paranoid, aggressive, and they might believe that everyone is being dishonest to them. They would repeat phrases, utter sounds, etc. would be there. The stage 7 is a very severe cognitive decline or severe or late stage of Alzheimer's disease, and that is 1 to 2.5 years. During this stage, the patient loses their ability to respond to their environment. They cannot speak, they cannot control their movements. They would be very limited cognitive ability they would be having. Swallowing would become impossible from them. Reflexes would become abnormal. Seizures are possible. Muscles grow rigid. Generally, they are bedridden. They spend most of the time in sleeping. So there would be loss of sense smell from the Alzheimer's patient. So these are the 7 stages which actually Alzheimer's patient go over. Now, what are the different causal factors and the risk of factors that are there that can cause this disease? First is the age. Obviously, as I've already quoted, the maximum people are 65 years are having this Alzheimer's disease. So your age is one of the factors of having Alzheimer's disease. A family history, if someone has obviously suffered from your this disease, you are already prone and you have a disposition for this. Then genetics, if it is run in your genes, and obviously lifestyle factors, the way you are living your life, and all obviously there could be biological reasons, like I've already told that the chromosome 1, 21, and 14 are responsible. So if there are problem in these chromosomes, you are automatically prone to the Alzheimer's disease. Thank you very much for your giving your time and seeing this video. We will be coming up soon with the next video. Till then, do subscribe our channel so that you can notify us, and do notify yourself regarding our new videos, and do press the bell button. Thank you so much.